Good day, everyone. On behalf of the Innovation Institute for Fan Experience, or IIFX, a warm welcome to all of our listeners around the world. And I know for a fact that we have an international audience today. We have a terrific forum planned for you today as we continue to explore COVID-19 and interscholastic athletics and try to answer a really important question. What is the medical risk? What are the risks in general for returning to play and returning to spectate? Today's discussion is the fifth installment of the Coronavirus Risk Playbook, which is a series created by the IIFX Medical Task Force. The series is designed to explore how the sports and entertainment communities are responding to the pandemic. The Medical Task Force broadcast, I'm very happy to say, will also be a regular feature in 2021. Goodness knows we're still having a lot of work to do as we roll in 21, even though a vaccine is around the corner. I'm Dr. Michael Anderson. I'm a pediatric critical care physician. I'm doing a one-year sabbatical at Health and Human Services, working on the pediatric aspects of the COVID pandemic. And I work for a company called Aveshka. I'll be your moderator for this forum. Aveshka is powering this series. The COVID-19 and other medical task force series brings subject matter expert leaders together to focus on current and emerging risks in sports and entertainment for venues, athletes, performers, fans, vendors, and staff, a really important audience. Before we get started, a couple of housekeeping items. Today's session is being recorded, so if your colleagues weren't able to join us live, we're called Return to Work, Play, and Spectate. We have a podcast available on Apple, Spotify, Google, and iHeartRadio. Once again, that name, Return to Work, Play, and Spectate. Tell your friends, because I think the dialogue we have had and the dialogue we'll have today is really, really important. A video of this session will also be available across our social media platforms, Facebook, Twitter, YouTube channels at IIFX_global. Your microphones are automatically muted when you join the webinar. We ask you to keep them muted so our panelists can be heard clearly. You're welcome to ask questions using the Q&A feature in Zoom, which is located and I'm sure you've all been doing Zoom meetings all day, all week, all year, but we prefer you use the Q&A function for questions, and then our colleagues from IIFX will tabulate them as we move forward. Please know you have the ability to adjust the view of the proceedings by making the picture appear as a full screen. And once again, please mute your phone if you have to dial in. If we do any polls during this seminar, we don't plan any, but if we do some, we'd ask you to participate in those polls. I think those are all really terrific. Again, thank you for participating in our webinar today. We think you'll find it informative, timely, and useful as you plan a really important topic. How do we get back to work and play and spectate, and how do we do it together? I know people are tired, people are exhausted, this has taken a toll, but we're getting there, and I'm really convinced that 21 will be a better year. I would now like to introduce our panelists, have them give a little background of who they are and how they got to this particular point in their career, and then each of them will give a little bit of a presentation before we get to Q&A. So without further ado, these are the really important people on the webinar today, and I'd first like Nancy Beatty to introduce herself.
And avoid
I don't know if you can hear, we have a loudspeaker going on. Forgive me 10 seconds.
Maybe we'll come back to you if that's okay. Andre, would you like to introduce yourself?
Yes, good morning, good afternoon, good evening to everyone. My name is Andre Walker. I am the Director of Athletics and UIL Activities for the Houston Independent School District here in Houston, Texas. We are excited and so proud to be a part of this panel, this great panel, and ready to give some of the things that we've been through, some of the things that we've learned while we've been going through this, and some of the things we expect to get out of it. Again, Athletic Director, Houston ISD Independent School District.
Andre, pleasure to have you on the panel. Nancy, is the overhead announcement finished now?
The public address announcement of wearing your mask is now over, so thank you. So Dr. Anderson, thank you for allowing me to join this panel today. I want to begin just saying how grateful and honored I am to be here. And also a big shout out to our Director of Safety and Security, Mrs. Kenna Powell, for recruiting me to join this panel. I've had the privilege of being in education as either a teacher, coach, and administrator, and sometimes all at once, the same position, I guess, for the last 30 years. I've coached many sport teams, but my primary focus was basketball, both at the high school and college level. I'm currently in my 8th year as Director of Athletics at Providence Day School here in Charlotte, North Carolina. It is the largest independent school here in North Carolina. And prior to that, I held similar positions in South Carolina as well as in Ohio. So over the last 30 years, and I'm going to take a wild guess here, but this is the most challenging year of all of my years together. And so again, I'm looking forward to the day where we can say, wow, this seems somewhat normal. But anyway, I am just so honored and grateful to be here. So thank you.
Yeah, normal will be nice eventually. I agree. Guy Grace, an introduction, sir.
Yes, I am Guy Grace. I am recently retired from a school district after 32 years as the safety and security director, emergency planning director. I am currently the safety and security advisor for the IIFX. I'm also the chairman of the advisory group for the Partner Alliance for Safer Schools, and I consult with schools across the entire country. I retired in August, the end of August. But the reason I retired was not because of the COVID, but it was because I met after all those years. So unfortunately, fortunately, I'm also a football coach and a baseball coach. But due to COVID, after coaching for the last 9 years, I lost that opportunity to coach this year because of restrictions due to COVID-19 in the age groups that I coach.
You guys, really glad you could join us today. And last but not least, Dr. Carissa Niehoff.
Thank you, Dr. Anderson. And I too feel very privileged to be a part of this very esteemed panel. My name is Carissa Niehoff. I'm the Executive Director of the National Federation of State High School Associations. The NFHS is a lot easier to say. And prior to my tenure here at the NFHS, I'm in my 3rd year, I came up through the ranks from being a collegiate athlete to then teacher, coach, athletic director in a high school, and then administrator at both the middle and high school levels, finishing as a high school principal. And then during that time, I also worked for some time with what was the United States Olympic Committee and their sport development division. And then was blessed to be able to serve as the executive director of the Connecticut Association of Schools, which was also the Interscholastic Athletic Conference. Did that for 8 years. And then the job here at the NFHS in Indianapolis opened up. And it's hard to believe we're in year 3 already, but I look forward to speaking with everyone about the national landscape and what we're seeing around the country at the high school level in terms of this very difficult challenge that is COVID-19.
You know, I've said it every time I've hosted one of these webinars, but I'm really humbled to be here because you all bring such a depth and a breadth and a broad experience. And we said it before we started the webinar, anything that we can do collectively to advocate for our kids, our student athletes, to somehow get back to normalcy. I'm just very appreciative of this panel being here. So what we thought we would do, we had a meeting a couple of days ago to sort of chunk out how this would flow. I thought each of the panelists could give a perspective on a particular topic. Each of our panelists could obviously speak on all of these topics, but we sort of just chunked it out into a little bit of a general topic. And then based on that 5-minute presentation each, we'll start to get into questions. And once again, we'll be looking to the Q&A part of Zoom for our participants to weigh in as well. So Nancy, if you could start, and once again, we sort of divided this up a little artificially, but that's okay. First of all, it's all about the kids. And if you're a child, as I said, my full-time job is working on the pandemic for kids. The good news is kids are not flooding the intensive care unit. Medically, most kids seem to do okay, although we have lost children in this country. But we know this pandemic has had an enormous impact on our children, on our athletes, on what is normal. So from your perspective, how do you see how this pandemic has affected our nation's kids?
Well, I can speak on behalf of our student athletes here at Providence Day, and I thought it would be best to break it into 3 concepts of time, like past, present, and future, to hopefully illustrate some of those perspectives. So since the beginning of May, our focus here was how could we get life back on our campus after the abrupt cancellation of not only our spring, but just everything around us. And after 25 weeks of doing this since June, I'm happy to say that we were very fortunate to make it happen and coexist with COVID. Our early days, we were focused on the physical and mental well-being of those students. And again, after that abrupt cancellation, it just seemed like everyone's world was rocked. And I have to give a lot of credit to the early guidelines that was sent out by the NFHS as well as our state association. These guidelines were a godsend, and they gave us a framework to work from, and it gave us a pathway to move forward. Without the guidelines and without our continuous conversations with a lot of our medical experts around the area, we could have easily been paralyzed with fear and caught up in that world of what if questions that had no answers. And so checking in with our student athletes early in August, we found it was very imperative that we get them back on campus somehow, some way. Again, just limited drills and limited numbers on campus, but by doing that, we found that they were just so happy. So by September, we implemented a very short fall season with limited competitions and limited travel. And we, again, here at Providence Day, we were very fortunate to have 438 of our student athletes participate in over 136 competitions in the fall season, and some of those into the state competition level. And less than half of the positive cases that we had on our campus were student athletes. So the myth that athletics was spreading the disease was not true on our campus. We had students thanking our coaches, thanking our athletic trainers and nurses. And it gave those early days of practicing without contact drills really helped them. It was a distraction and a coping strategy for many of our student athletes. So the mantra was not only stay 6 feet apart, but to our coaches and athletes, we also said stay flexible and fluid, because this could change on any given day. I did have a young man say to me, he said, every time I saw you come towards our practice, I feared that you were going to come tell us that our seasons were over or our season was ending. So currently our new mantra is every practice and every game is a gift. Our senior parents and players realize this, the importance of this the best, and they can easily see in every day around us, whether it's the NFL and the college level, where one case can really wreck a season or put it on pause for a period of time. So as we are entering into our winter indoor season, we're faced with new challenges. Our student athletes now just are coming off of the new policy of wearing a face covering while they're participating in athletics. And last night was one of our first competitions, and they hit the ground running, and they were accepting and ready to assume the risks that go along with wearing that mask, or the difficulty of wearing that mask while being physically active. So what does the future hold for us? There's still a lot of uncertainty, but we are seeing the mental fatigue of remote learning, dealing with COVID cases at home and in the community, as well as other social issues on the rise. And so we're talking with our counselors here on campus and about trying to provide to our parents, to our students, other resources that are going to help them manage this anxiety and this new stress. Our coaches are also, we're talking with them, with our counselors, and educating them on red flags and what to look for, and be able to not only talk with our student athletes, but also send them to the counselors or alert the counselors that our children are in need. And so what we're finding too is, for the future questions, is some of our student athletes are really worried about what the future looks like if they want to play at the next level. What happens if a season is canceled? What happens to their recruiting process? What happens if they are the one that catches the COVID and causes their team for a 14-day quarantine? They're all asking the ultimate question: when will we get back to normal? When will this be what we're used to? So every season is filled with much gratitude, but it's also embedded with fear, with anxiety, with a lot of uncertainty, and which we're all feeling. I understand that. But, I think our kids are resilient. I think they are happy to be playing. And I will never forget in June, when we opened up our doors, we had all of these protocols in place, and we were drilling them the importance of those protocols. but just the overall happiness of being able to be back on campus and to see their teammates and to socialize in person with one another. But there's still a lot of unknown, and there's still a lot of, questions about how this will impact their overall well-being. But right now, they're being great about following the protocols, and of course, we're making mistakes, but we're correcting those as we go along. But overall, our kids, they want to participate in athletics.
Nancy, that was absolutely terrific. And there's a couple of things I want to put a pin in, and that's how your protocols worked and were flexible. We'll come back to that. On our pre-conference conference, we talked about mental health, and I think that's something I really want to talk about. And just, I think your audio was a little choppy, unfortunately, but I did hear you say,
Sorry.
that every practice or every game is a gift. And I just think that humility is just absolutely, or that's just terrific to be that grateful. There's another constituency that Guy alluded to that I'd like Andre to address. Once again, each person on the panel could talk about all of these things. And that's the coaches. I think we haven't, at least in the seminars I've run, talk a lot about the coaches, but this has had a real negative effect. And I, as a pediatrician, know that coaches are another set of eyes and another really important foundational element to a lot of kids' lives. But they're also dealing with the stress of not being able to practice their art and to help kids. So we asked Andre if he would sort of address this pandemic from the coach's perspective.
Thanks again, Dr. Anderson. And Nancy, she hit it right on the head with those points that she made. For us, being the largest school district in the state of Texas, having over 210,000 kids, plus 300 plus campuses, and almost 1,200 coaches, it was very important for us to make sure that our coaches were not on this roller coaster ride that most of everybody was on, right? The roller coaster ride from stress to worry, back to stress, then to worry again. And we saw that a lot, but our message to them was to, number one, take care of yourselves, because we know if they didn't take care of themselves, they couldn't take care of others. We was fortunate to have 2 of our stadiums as testing sites, and we encourage our coaches to go get tested, have your families tested. And when you talk to your players, make sure they go get tested, because if you knew what was going on, you knew how to handle and channel that piece of information. Also, we had food distribution centers across our district, and that was important because a lot of kids couldn't get the proper nutrients that they needed, and coaches had that issue as well. And so we made sure we continuously pushed out those food distribution centers so we could make sure that our kids, coaches were constantly getting the food that they needed to survive from day to day, right? And then it went from that to the team impact, and we talked about them staying connected to their players, whether that was by phone, by Facebook, by FaceTime, by Zoom. It was very important that they now get off the roller coaster and make sure that they're impacting and talking with their teams to keep those student athletes focused on the next steps and the next things that was coming up. And then we wanted them to stay updated, right? We knew information was emerging and still is emerging hour by hour. They needed to know what was going on. Don't let it overwhelm you was our message to them, but make sure you know what's going on. Know when to disconnect and step away from time to time, but then go back so you can pass those messages on to your kids and their parents as well. We all know that exercise was a large piece of this puzzle and very important, especially for our coaches, because our coaches are the worst at taking care of themselves. And why is that? Because they're always taking care of others. And so this was a time for them to really engage. We know that exercise it helps you manage stress. It helps fight illnesses, and it maintains a positive attitude. So, that's another thing that we wanted our coaches to make sure they did during their time off. And then after that, it was, okay, we're coming back. And then what are we going to do once we get back? And so we start talking about scheduling. Scheduling was very, very important because the schedule we had was good no more, right? We had to make sure we adjusted the schedules and supplies. What supplies are they going to have to disinfect, to clean, and to do those type of things? They've had to not only coach, but they've also had to now do some custodial work and cleanup work because it was important to make sure that everything was clean every time, not missing a beat every day. Because now that we've gotten to this point where we're able to play, how do we stay out here? How do we manage continuing to be out here? And then we had to deal with spectators and travel. What were we going to do with spectators? What were we going to do about our team traveling? Of course, we had to increase buses, right? No longer could we have, fit everybody on one bus. And so we had to get additional buses for our teams. And then it was the designated COVID-19 point of contact. Who needs to know when somebody gets infected? Who do we contact? Who do we tell? How do we do that? How do we, follow those steps? So that's part of that communication system. And then again, our coaches are not medical experts, but recognizing the signs and symptoms of their student athletes. Once they got back, how do you have to be more in tune now than you ever have before to your student athletes, because you have to see things sometime before their own parents saw them, right? And looking at them and knowing them. And so that was a lot of stress, and it continues to be a lot of stress on our coaches, but they are handling that in a very, very positive manner. And then you go to facilities. Some school districts have multiple facilities like we do. We have field houses, and we're blessed to have that. And our varsity level competitions are played there. But then you have some school districts that just have, their school, and that's the only place they can play. And so just those kind of things were major in a lot of the decisions that we made to return to play and to continue to work with our coaches and work with our principals on taking those next steps to continue to participate.
Well, I want to welcome you to our first 6-hour webinar, because I now have about 5.5 hours of questions. So I hope people got caffeine. Andre, that was so good. And just one, we'll unpack a lot of this during Q&A. The amount, I was so heartbroken when I heard Nancy say that an athlete is worried, am I going to be the one that either infects my family or causes my team to shut down? That pressure on a 15-year-old kid is unbelievable. And now what I hear you saying that I didn't think of before you presented, now I've got a coach that's part coach, part counselor, part infectious disease doctor, part triage nurse. And that's not, that's what my friends do for a living. That's not what coaches do for a living. So the mental health pressure, in addition to all that every American is feeling, is just really unbelievable. Andre, that was absolutely terrific. And you also brought up an important constituency that we'd like Guy to address, and that is the fans. One of my most fun experiences as a parent, and eventually when the grandbabies get older, is just to be a part of these kids' lives. And yet, in the middle of non-normalcy, in the middle of this chaos, that the fans have really been affected too. So once again, we divided this up and are hoping that Guy could give us some input from the stands, if you will.
Hi, good. Thank you. And it's an honor and a privilege to be here today. And as a coach, one of those things is most of us are volunteers as coaches, especially when we're working with the younger kids. So it's a privilege for us to work with those young people when we do it. I as a coach, I did it as I exercise and things, but I also did it as a stress relief for me after my very trying job and things. And so it's a privilege to be there. But as we're talking about fans and coming to these events, it's most important for our fans. Now, the schools are taking great responsibility. The local health departments are taking great responsibility in setting up the parameters for the schools to run these sporting events and these after-school events. And when we think about that, that is so important, because one of the things we overlook is the responsibility of the fan when they attend these events. So a fan, when we look at that, they should be aware of the number of COVID cases in their community before they go to these events and where they're going to these events. Like, for example, I've had the ability to attend my young son's football games and to go visit other school districts to learn about what they're doing in COVID and things. And thankfully, there's been a lot of sports going on, soccer, football. And one of the events we must not overlook is the events such as band, cheerleading, that support these groups. There's a tremendous amount of young people going into these events. But as a parent, and knowing grandparents and other fans that go to these events. It's so important for our normalcy of our communities to have the ability to attend these and see our loved ones being on the sporting fields, and for those young athletes to look up and see their loved ones watching them play. And as Andre has stated, the biggest worry of that is, the young man and young women out there, they're worried about their loved ones becoming sick at these events. But as the adults in the room or the fans, we do have expectations, and I think that's lost on a lot of individuals. So when we know that, a fan should be looking at the number of COVID cases in their community, and if their group is traveling, their event is traveling, they look at what the COVID event is at that facility. Now, we look at the statistics. It's University of Wisconsin did a study recently on the number of young people that have been impacted or infected at these events, and it's very low for the kids. I think it was 276 out of 30,000 students were impacted. You can look at that University of Wisconsin study, but the higher a number of people being affected would be the possibility of the crowd. So when we look at the parameters of a school district, it varies from country to country, from jurisdiction to state from state, jurisdiction to jurisdiction. Most states are allowing in-person visiting or fans to come to the event, but that's often based on the perimeter of the sporting venue and the ability for them to maintain 6 feet of distance between guests, a family, and guests from outward. So you will see, like in my stadium here, we can only have 75 guests in our stadium to watch a football game. But when we look at indoors, so right now we have basketball seasons starting to come up, wrestling seasons and things like that coming up. Now, when we look at outdoor events such as soccer and football, baseball, and other events, the likelihood of an infection of a spectator and a player is much lower. But when we get into the inside events, so to say, then the parameters start and the chance of a COVID transmission grow higher. So we've had the privilege of learning from the outdoor events of this football season. The last year at the end of the year, when some of the school districts ran baseball season and soccer, spring soccer and lacrosse, we had the ability to learn a little bit. But there's going to be in this next couple months, there's going to be a lot of learning that's going to be having. So the big thing is for us as fans, we need to, when we attend a sporting event, we need to realize that the closer we are and the closer we have an interaction with an individual increases our ability to be impacted by COVID. So our young people that we were there spectating to watch and be very proud of probably have a less chance of being infected with them playing on that field or on that baseball field or on that basketball court or that wrestling match. The problem for us is we, as the spectators, we have that higher chance in there, especially if we don't do that. But there are keys for things, personal responsibility, but it's also the personal responsibility is to understand the rules before you get to that function, because some school districts will have varying, spectator rules, where another school, as Andre talked about, is you need to understand what those rules are going to be from school district to school district. And as a spectator and as a coach, I'm going to overdo it, so to say, for myself. Okay, I'm going to have my mask or some kind of PPE when I go there. So fans, you need to be doing that. The other thing to keep about, the greater number of sporting events someone attends. So it's important for us as spectators to maybe look at what the most important event for us to attend to watch our loved ones is playing, and that sometimes it might not be good in this day and age for us to attend every one of our sons or daughters' events. Does that make sense? It's cutting back and being selective about that, because the more events you are going to attend, the more likelihood that the chance of you of getting COVID increases. So when we look at that, there's all kinds of events that go on. And the big thing is all attendees should wear a mask. And another thing that is really hard is things like thinking about chanting for our team. And even though we might be wearing masks, we increase the probability of droplets in the air and things like that. So things like that, thinking about how I could spread something, we need to have that responsibility. And we must always maintain our social distancing, and we must, as a family, limit the guests coming to these events. Now, many high schools are doing that. They'll give 4 tickets, or they say the moms and dads are the only ones allowed to come to the event. In my community, that happened, where only the moms and dads were allowed, and none of the little sisters and brothers. Maybe those little sisters and brothers, as we look at statistics now, would have been safer than myself and my wife to have attended those events. So we need to look at and you need to look as a guest, understand what the mitigation strategies are of the event that you're attending. And when you're doing tailgating and things like that, the event, if you're going to attend an indoor event, understand what the ventilation is in that school. Ask questions and things like that. The school district's going to tell you. And again, the social distancing when we're indoor. Another one that we like to do at these events is we like to share food. We like to share our drinks and things like that. And that's just being a good person and a good human and a good family member. Avoid that. Avoid doing those things as much as possible. And then when we travel to a geographic area, we need to realize, like, if you go to an event and it's being held in a poorly ventilated area, or an area where maybe they're not doing the things they need to be doing, don't attend that event. Make sure you communicate to that school district in a safe way. The thing is we have responsibilities as individuals, and it's not always on the school official. It's not always on the coach. The other thing is, if you got a cold right now, if you are feeling ill, stay home as a fan. Don't go to work, don't go to the event, stay home, and those things. Check with the update. Again, biggest thing is personal responsibility. Check with the event providers, find out what is going on, what you're coming into. If you have medical conditions, it's, you might want to right now take your doctor's advice and stay home and find an alternative way. Like we're doing this Zoom meeting today. I've seen in events, more of the athletic events being on televised and things like that. And that's helping us right now. Of course, there's nothing better than being there cheering on your loved one, or watching your son or your daughter march in the band, or your daughter cheerlead, or your son cheerlead, whatever it may be. You want to be there, but we want to be there in the future to see him when we return to normal.
That's the key. Like, there are sacrifices. Guy, that was terrific. A really excellent summary. And we are making sacrifices now. I think, hopefully, everyone is. We just got to get back to normalcy, and the more we work together, the quicker we're gonna be there. And I keep just fascinated and a little terrified by the enormous pressure that is on everybody. We talked about the pressure on the kids. We talked about the pressure on the coaches, and you did an excellent summary of what fans have to keep in mind. But we're now expecting them to think like, people that have masters in public health or physicians. It's just, there's so much pressure on normalcy in America. So really wonderful summary.
If I want to, like we talked about beforehand, I think it's real important as a father who has a child who has, struggles with his grades and things like that, but who is extremely athletic, like very gifted. I think it's so important that, we look at the correlation of the after school activities and academic performance and things like
Exactly.
that. And how much they, Andre stated it, and Nancy talked about this a little bit too, is the self-esteem of our students and the self-esteem of our families. It helps keep our families intact, and it helps those children with their academic performance and their mental health.
Amen. Thank you, Guy. Dr. Niehoff, I would imagine from the world of organizing sports and organizing teams and districts, that's a very intense, complicated job. And now throwing in all of these concerns that were just outlined by your 3 other panelists. Can you give us in 5 minutes or so just the view from the organized approach to this and what you've been seeing?
Well, absolutely. And I think they did a great job outlining the complexity of this issue. I think if we back out and take a look at what has happened over the last 9 months, nationally, what we have learned is that number one, the institution that is sport, be it at the youth level through scholastic, collegiate, and on to professional level, the institution of sport is so important to our society, and it has been crippled by this. I think what we've learned is that it is a very complex institution. What I love about creating the IIFX is that the fan experience has been kind of memorialized now as an important part of this institution. So I applaud you all for doing this work. What we're seeing at the national level across all 50 states and then Washington, D.C., which has an association of its own, and this would be about 20,000 high schools. And these are just member association high schools. There are other private school organizations as well. So we're talking 12 million student athletes just within our membership, hundreds of thousands of coaches and officials. We're hearing what Nancy and Andre and Guy have described. The range of concern, the range of readiness or lack of, the frustration and fear around appropriate resources, and most importantly, the broad perspective that we have to keep when we talk about risks associated with participation or not. What we've seen since March is absolutely a mosaic, a very fluid one. This situation is organic. Whether you're looking at something from a state level or a local level, what we need to value is the importance of collaborative decision-making in this process. We're seeing high schools working with school districts and health agencies and governor's offices and legislative offices to try to get hands, arms, hearts, and minds around this thing. And it's different everywhere. And that's been frustrating for people. We, in our office in Indianapolis, have tried to keep a daily handle on what's happening around the country. And if people are interested, if they go to our website, which is www.nfhs.org, one of the scrolling resources is we keep these running charts of decisions based on a state level about where they are with return to play and sport. We also are in the tail end of a study looking at aerosol spread in speaking, singing, cheering, playing musical instruments, and aerobic exertion. And we're learning a lot about aerosol spread. So those are a couple of resources that we try to keep available for our national membership. One of the things that we also learned early on, though, was that we had very little to go by it. And you, as a medical expert, a research expert, will know we are in the caboose with this thing. We really didn't have a base of research by which we could inform decisions. So we're really learning as we go. A few of the panelists have mentioned the stories that we're hearing about state association and high school participation. Leading up to this point, we've heard that where states have in fact engaged in interscholastic participation, we're not hearing about transmission concerns at an alarming level, if at all, due to direct sport participation. If anything, we're hearing about kids that are bringing a COVID positive situation to school from another event, or it's not happening on the playing or practice field. Now, do we have a ton of data about that? Not yet, but we're trying to gather that as we go. We have a few surveys in place right now that we're using through the University of Wisconsin, in fact, that our National Sportsmed Advisory Committee is supporting. So we're scrambling to try to gather data. We're hearing anecdotally, especially, that the success stories far outweigh any concerns about transmission due to participation. What we are hearing that's been shared already is the mental and emotional situation and concern when we're not having kids engaged. So we're trying to provide resources to guide decisions about getting back to activity. We provided resources specific to sport about potential rules modifications that might help with social distancing, but still being able to play. All sorts of creative thinking that we might be able to apply as we get kids back into activity, certainly phasing them in and monitoring that gating process, looking at those numbers on a daily basis, and then just really asking everybody to keep a broad perspective and exercise patience. We don't want kids jumping town lines just because their school may not be playing football until is the spring months. So transfer issues and things like that, that we've really tried to say, everybody just be patient. There is no state in the country right now that has canceled any sport for the 2021 school year yet. We hope there isn't one. But they've definitely moved things around to respond to governor's messaging, legislative messaging, health agency messaging. But I have to say, in the big picture, decisions that are being made are being done so collaboratively at the high school level. I applaud our state associations and our schools. They've done a fantastic job being nimble and being careful, balancing caution and care with common sense. The one other area of concern that was touched upon a little bit, we're concerned going forward as we get back to a new normal about the impact financially. It's not going to be a quick recovery. And unfortunately, in the areas where a lot of our kids need these activities so desperately, those are the kids that are still disengaged. They've been sidelined, and we're really concerned about resources to support these kids. Unfortunately, the demographic and socioeconomic differences take a tremendous turn when we don't have resources in place. So those are some of the national kinds of things that are very complex that we're seeing really being dealt with in a really an ad hoc, nimble kind of way as we learn more about the impact of COVID on young people and on participation.
Well, I want to welcome you to our first 8-hour webinar, because now we'll be discussing this for another 7 hours. That was just amazing. And Dr. Niehoff, we have heard on each of these webinars, and I'm very grateful for the Institute as well to bring folks together to talk about this. And you just encapsulated why sports is so important to the fabric of this country. And it has been decimated. And 2021 is going to be a rebuilding year in so many sectors. But our kids need this to go well. And I think you said it so articulately. We've heard on each of these webinars, at least the ones that I have hosted, that same sort of, we've seen best practices of collaboration, high school, health department, state, governor, and it's worked. But I've also heard everybody thirsty for, but from the national level, it's always been this patchwork. And I think there's a lot to do in 2021. I'm very hopeful for 21 because the vaccine is almost here. And just as a medical professional, seeing that vaccine go from 0 to almost here this quickly is really reassuring. It's amazing what pharma and the government and researchers have done. But we've just got to get better at this the next time, because there's going to be another pandemic. We don't know if it's 10, 20, or 100 years. And I'm hopeful in 21 we learn from this and get better at it. So just a terrific panel presentation. I'm only half joking. I wish we could go 7 hours. I want to come back during the Q&A. And once again, for those of you on the line, for those of you listening on the podcast, I'm sorry you can't ask a question, but I'm going to kick off a couple of questions in the time we have. I want to come back to something Nancy said. I'm so heartbroken that as you approached, people thought, oh my gosh, she's here to axe the season. And that's just a horrible thing. But I'm sure each of you, and this is probably not a fair question, but oh well, each of you had parents or athletes or someone just say to you, how do we get back to normal? I think each of you have encouraged patience, working collaboratively, but I'll open it to the panel. When people ask you, what do we need to do to get back to normal? I sort of know the medical stuff, but what are you saying to them?
I guess I can talk. Hopefully you can hear me. but we truly, I mean, when I say drill the protocols and the importance of those protocols, we have to be able to follow those and those guidelines and be able to keep one another safe, to even get to even the idea of normal. And again, just trying to help our families recognize that even off campus, that's the challenge. But for me, we've, like I said before, we've got this framework, and it's a great framework and it's a great pathway. But just at this point, getting ourselves to follow the protocols to kind of continue to have our kids on campus is key.
Everybody's tired, but we got to keep it up.
Yep.
Dr. Anderson, for us, that's what we've said. Don't get comfortable anywhere, not just while you're at school or not just while you're participating, but while you're at home, in your neighborhoods, in your communities. Don't get comfortable anywhere.
I think another thread that I heard in the presentation is the mental health toll that this is taking. There is a physical toll, and there's a lot of intensive care unit beds that are way too occupied right now, and it's a rough couple months coming up. But the mental health toll, I think, is going to be generational in its impact. And I think if we're going to make an impact, each of us have to, and I think you each said it, we've got to keep an eye on those kids in front of us, especially the most vulnerable amongst us. Carissa's point about thinking about cutting these programs when the school districts are facing such fiscal peril is just horrible. So I guess speak to me both at a micro level of what you're nervous about. I'm not asking you to be mental health professionals, but then sort of from an organizational standpoint, how are we, once again, to that collaboration, how are we keeping an eye on kids' mental health when this is just such a terrifying time?
I'll speak just from the NFHS perspective. One of the things that we've learned is that we've got to take advantage of this opportunity at the point that we're at right now, as we pivot from 2020 to 21 with vaccine in sight, that we also have to pack some things to take with us. And that is, this is absolutely a time for us in the ecosystem of sport and activity to challenge ourselves with becoming more educated. If we don't explore our own learning around social emotional learning in the brain, the growth and development of the whole child holistically, then shame on us. We have to have that in our wheelhouse of expertise so that when we go and message and advocate for these programs, whether it's for funding or for fields or for whatever it is, we've got to be able to make evidence-based decisions about more than just the fact that we don't want these programs to go away and the community likes it. We've got to talk about the value for kids. So I think it's incumbent upon us nationally to work together across organizations. I see Anna's on from US Lacrosse. We have a great relationship with lacrosse, NGBs, schools, the NIAAA. We've got to get together around this, drop any kind of territorialism about who owns sport and talk about who sport is for. And I think we're realizing that this has fast become a priority for us. We're hearing from state association leadership out there that their schools are reporting alarmingly high numbers of student suicides, 7th grade through 12th grade. And these are coming from states that are sidelined right now. So I can't speak any more officially than that, but that's what schools are telling states, are telling us. We've got to get these kids back.
Really, really well said. And just the suicide rate in this country is scary. And as a medical professional, we're seeing it nurses and doctors. Like you talk about the heroes in the front line, and I consider you all heroes because of what you're doing for our kids. The frontline intensive care, respiratory therapists, and nurses and docs are just, you can't even fathom the pressure that they're under. I want to take us back to a one-on-one conversation that I'm sure a lot of you have had or will continue to have. And that is a parent or a grandparent who comes to you and says, we've been telling everybody, stay home, wash your hands, like become just isolated off. And yet you all have articulately said, yeah, but there's a fine balance here because we've got to get kids off the couch. We've got to get them learning about how to be a good athlete, how to be a good winner and a good loser. We've got to get back to this. And so if there's a parent that you're counseling, or not counseling, I guess just talking about, how do you weigh the risks and benefits of their particular, it's very personal, right? It's their child or their grandchild. How do you help coach, I guess is the word, parents through the go, no go decision to let their child come back?
Well, I'll go and then everybody else. My big thing is, as a school official or as a safety consultant or so-called expert, is being informed and having the correct information to give to that stakeholder, that parent, and letting them know, or that community member that wants to come to the event, to understand how their child will be infected or impacted by playing the sport, but also as a participant, as a parent, what the expectations is. Like, for example, I feel like we as a parent here, we get a communication that we have to sign up and give the information back to the school district about who our child is contacting on a given day at home and things like that. Because if something happens at school with our child and they are impacted or, become sick from an event, obviously that's going to impact the entire family when that kid comes home. We're going to be quarantined and things like that. So we just need to be informed, and we need to understand that we're giving correct and pertinent information. I can say, as I said, I just recently retired, but it was amazing to me how much the COVID response changed between January and September there, of what the requirements were. Because as Dr. Carissa Niehoff said, we're still learning, and there's a lot to learn yet to come.
Any other words of advice for worried families out there? So let me, unfortunately, it is not a 7-hour webinar, and I listed another 100 questions. Let me ask you, each of the panelists, as we close, you can answer one of two questions. It's sort of like playing a game show here. What's one point you want everybody to take away from the webinar, and realize that our participants, both in the podcast and here, come from all sort of varied walks of life and jobs, et cetera. What's one point you'd like to take away? Or two, when we write the book on how to do this better, we hand the baton to the next generation that will, unfortunately, there was the 1918 Spanish flu, and now we are, unfortunately, the 2020 COVID pandemic. What can we do better the next time? So either just one takeaway, or how do you think, God forbid, in 20 years, we struggle with this again? What do you think we can do better? So Nancy, I'll start with you.
Well, it's sort of, for me, it kind of piggybacks on what was just being talked about, but this is a universal problem, and we are all in this together. And so the more that we can, as Dr. Niehoff said, drop our boundaries and kind of realize what our goal is for the student, and for our children to be safe and to be playing in terms of athletics, the more we can understand that this is a universal problem and that we all can relate to this, I think the better off we will be.
I mean, I can't say anything different than what they've said. Take self out of the way. This is not about you.
Yes.
This is bigger. This is much bigger than you. And I think if we do that, then we'll get to where we need to get to much faster. And if we understand what this is about, it is about our kids. It's about our student athletes, and we can get them where they need to go so they can move forward and be prepared for the next time something like this happens.
I'm going to say this, schools have mitigated many unknown emergencies over the years. We've, as a responder to active shooter incidents or things that have happened. And we're still not even halfway point through this COVID. There's things that schools are going to be doing. We're going to be helping officials like, the medical fields in POD, or point of distributions, for when the vaccine comes out, and things like that. Schools are going to have a role in those things. So we still have a lot to learn on what is coming. And I think that in an essential way, everybody in this room, every school administrator, every coach, are all essentially pioneers, and you're paving the way for the next emergencies that may arise. So It's, I would say because school districts have been dealing with the unknowns for many years, that we were able to rise to the challenge and will continue to rise to that challenge and share good and positive things to impact the future and a positive so our children can learn.
And I want to highlight something you said. Unfortunately, I got to the questions late. There was a couple of questions about testing and points of distribution. I apologize we didn't get to do a deeper answer. I will agree with you and sort of put a pin in the fact that, back to Carissa's point about collaboration, now that we've been working hard on a vaccine and we have been building this aircraft as we're flying it, or whatever the analogy is, schools are foundational to these kids and to our communities. And I think you're exactly right. We still got a lot of things to learn together and a lot of things to do together. But once again, thank God a vaccine is almost here. And now we've just got to figure out, and I'll stand on my soapbox for 2 seconds. We have to get a children's vaccine strategy going. And I'll keep talking about that in my day job. Carissa, final point or thing we can do better? No pressure.
Well, my goodness, and maybe just to consider the question that came in about the testing, I think one thing we will be doing better as we learn more about COVID is also relative to the impact on the cardiorespiratory functions that we have. So I think we will start to see a deeper dive into pre-participation physicals, histories of students and conditions, pre-existing conditions, exposure, anything there. Again, so much more to learn, but and also probably looking at a little bit more in the resource department for being prepared, some of the emergency action strategies that we have to have in place. This is here to stay now, and whether it's COVID-19 or the next strain, I think now we've been tested, and I think the institution of sport has responded beautifully, really. We didn't just say, we're too important for this. We were concerned, we didn't panic. So I think we've come through realizing that we're worth it. And so I think we'll see some things change in the way of testing, monitoring, historical documentation, and a little bit more attention to health and risk minimization in a deeper level. But we did a good job.
What a poignant way to end our 8-hour webinar. That was absolutely terrific. And as I mentioned at the beginning, we're going to continue this series through 21. And I think we've just captured 4 or 5. Quite frankly, we could have webinars about returning or the student athlete, pre-participation physical. You hit the nail on the head as a pediatrician. We're going to have to do a lot of thinking around that. So I just want to thank the panelists. I'm just going to try and close this really quickly. Please check out our website, iifx.org. I am so appreciative of not only this panel, but all the other panels that we've had and that we will have in the future. You can also subscribe to our Return to Work, Play, and Spectate podcast, once again, at IIFX_global. Just a world-class panel, a world-class discussion. I appreciate everybody so much. Please stay safe, and we will talk again soon.